Hi there, I'm Dr. Rob Mirandola from the Foundation Chiropractic just outside of Boston, Massachusetts. I thought it'd be really cool for you guys to come in and take a sneak peek inside our practice and kind of get an idea of what a typical practice member experiences within our practice walls. So, in these segments, I'll be sharing with you real cases with real results using the Gonstead chiropractic method, with the goal of restoring strength and integrity of our practice members' spinal structure. And because spinal structure and neurological function are inseparable, I'll be sharing with you real results that we were able to attain through our unique neurostructural restorative process.
As our initial examination ranges between 10 to 15 structural, neurological, and physiological tests, depending on what's appropriate for the patient, I'll be sharing with you the most significant ones from each case. Today, I bring you this 34-year-old male patient who consulted us with concerns of chronic neck pain, bilateral shoulder pain, poor immunity, getting colds frequently, and fatigue. This affected his sleep, his energy, his digestion, his work performance, his mood around his family, and his ability to play with his young son. His structural images showed loss of a healthy neck curve seen here. In this image, the solid line represents where his neck should be, and the hashes represent where his spine has lost a healthy position. Rather, you shouldn't be able to see the hashes as they should be flushed with the solid forward arc. It was found through neurological testing that the cause of this was a nerve stress at the top of the spine at his occiput, shown with the red arrow. His spine was beginning to stack in what's known as a straight neck or military neck. This is serious because the longer it's left to progress, the more the body will likely form arthritic changes to stabilize this area. This animation describes this physiological event best, as his head was continuing to shift forward. It was putting the additional stress on the spinal segments and at the base of his neck and into his mid-back. The image here shows his static electromyography test results. This test is performed to evaluate inappropriate energy expenditure at his muscles lining his spine called his paraspinal muscles. These muscles are designed to hold us in an effortless upright posture. The image to the left shows a normal, healthy test result, whereas the patient's is illustrated on the right. Now, all of the colors you see are where his spinal muscles are working outrageously harder just to hold him in an upright position. It's important to note that we all wake up in the morning with a single tank of gas or energy, and that all of our systems feed off of that one gas tank. If we are blowing through our energy stores just to stand up straight, then this means we have very little energy left over for our other systems, such as digestion, immune function, etc. Remember how we said this patient had immune issues and digestive problems?
This member's initial phase of care consisted of 4 months of spine and nerve system checkups, with progress examinations along the way and a new radiographic image after his initial phase of care. Our goal throughout his entire first phase was to elicit and monitor neurological change and see positive structural change. And that's exactly what happened.
Take a look at his pre on the left and his post on the right radiographic structural images. These show obvious improvement to his neck curvature, creating better alignment and strength structurally. And again, because structure and neurology are interconnected, we saw remarkable changes to his electromyography assessment, noting significantly less energy wasting at his paraspinal stabilizing muscles.
This particular practice member reported at that time some pretty remarkable changes to his quality of life.
Reporting better posture, no pain in the neck or shoulders, higher energy, better sleep, improved elimination, improved immunity, and the ability to handle stress better.
So thank you for joining me today, and I'll see you again for the next segment. Until then, make it a great day.